InviaFoam Dressing Kit with FitPad application video. The information in this video is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. Safe and effective operation of this device requires specific instruction from a medical professional. Before initiating negative pressure wound therapy treatments, read and follow the instructions for use. InviaFoam Dressing Kit with FitPad. The InviaFoam Dressing Kit with FitPad come in small, medium, large, and extra large sizes. Each kit contains foam, transparent film, and FitPad. Do not use if sterile package is damaged or opened prior to use. Prepare the wound. Thoroughly clean and debride the wound as instructed by a physician. Ensure peri-wound is clean and dry. Application of protective skin barrier may protect the peri-wound from exposure to moisture and adhesive. Protect and fill the wound. A non-adherent contact layer may be placed in the wound bed prior to the foam if required. Cut the foam to fit the size and shape of the wound. Do not cut the foam directly over the wound. Rub the edges of the foam to remove any loose fragments after cutting. Place the foam into the wound cavity. Foam should be cut to fit loosely into the wound bed without overlapping onto intact skin. Do not tightly pack or force foam into any areas of the wound. If multiple pieces of foam are being used, count and record how many foam pieces have been used. Applying the transparent film. Cover foam with transparent film. The film should extend 3 to 5 centimeters beyond the wound margin to facilitate an adequate seal. The transparent film can be cut into multiple pieces for easier handling. There are 2 common ways to cut the transparent film. It can be cut in either strips or squares. Make sure to retain a portion of the silver-colored handling bar on each piece. Partially peel back one side of layer 1 and place the adhesive side down over the foam. Do not stretch or pull. Next, remove the remaining side of layer 1. Now, remove the transparent top layer labeled 2. Finally, remove the perforated silver-colored handling bar on the side. The transparent film should be adequately anchored to the peri-wound area to maintain an airtight seal. Cut a hole in the film. Select an appropriate location over the dressed wound bed for the suction pad, FitPad, to be applied and pinch the transparent film over the area, lifting slightly. Cut a small hole in the pinched area, approximately 1 centimeter in diameter. Attach the suction pad, FitPad. Peel off the backing of the FitPad. Center the FitPad over the previously cut hole in the dressing. Apply by pressing firmly for adherence. Pay attention to the tubing positioning to allow for optimal flow. Avoid placement over bony prominences. If there is a concern of the tube creating pressure on the wound margins, utilize bridging technique. Connect the dressing tubing to the pump tubing. Connect the dressing tubing to the pump tubing using the quick connector. Make sure both parts of the quick connector are aligned correctly. Push the quick connector together until you hear an audible click. Turn on the pump. Turn on the pump and select the prescribed therapy setting. Check that the seal is secure around the transparent film and suction pad. The finished dressing should be firm to touch. Dressing changes. Dressings should be changed every 48 to 72 hours. Invia negative pressure wound therapy is recommended as a 24-hour therapy without interruption. If therapy is discontinued for more than 2 hours, the foam dressing should be replaced and therapy restarted by a healthcare professional. In the event of heavy drainage with sediment, or infected wounds, more frequent dressing changes may be needed. Check the dressing regularly and monitor the wound to check for signs of infection. If there are any signs of systemic infection or advancing infection at the wound site, contact the treating physician immediately. If the patient experiences discomfort during the dressing change, consider pre-medication, the use of a non-adherent contact layer under the foam, or managing the discomfort as prescribed. Dressing removal. Turn the pump off. Close the clamp on the dressing tubing. Close the clamp on the pump tubing. Disconnect the pump tubing from the dressing tubing by pressing on the side of the quick connector. Remove the transparent film from the skin by gently pulling parallel with the skin. Remove the foam from the wound. Ensure that the same number of foam pieces that were placed in the wound have been removed. Dispose of the dressing in accordance with local guidelines. If the dressing adheres to the wound, apply normal saline into the dressing and wait 15 to 30 minutes before gently removing the foam. The InviaFoam dressing kit with FitPad is intended for use in conjunction with the InviaMotion and InviaLiberty negative pressure wound therapy systems. The InviaFoam dressing kit with FitPad, in conjunction with the InviaMotion and InviaLiberty negative pressure wound therapy systems, is indicated for patients who would benefit from a suction device, as it creates an environment that promotes wound healing by secondary or tertiary intention, by preparing the wound bed for closure, reducing edema, promoting granulation tissue formation and perfusion, and by removing exudate and infectious material. Indications. InviaFoam dressing kit with FitPad is appropriate for use on the following wounds: acute or subacute wounds, chronic wounds, dehisced wounds, pressure ulcers, diabetic neuropathic ulcers, venous insufficiency ulcers, traumatic wounds, partial thickness burns, flaps, and grafts. Contraindications. The use of the InviaFoam dressing kit with FitPad is contraindicated for necrotic tissue with eschar present, untreated osteomyelitis, not enteric and unexplored fistulas, malignancy in wound with exception of palliative care to enhance quality of life, exposed vasculature, exposed nerves, exposed anastomotic site of blood vessels or bypasses, exposed organs.